We started?
Yep.
We have begun.
It certainly has. We'll just probably give it a couple of minutes just to...
Yeah, it's literally going up by, I can see it on my screen going up every second.
Fabulous. Hello everyone. Welcome to our webinar.
Happy Wednesday.
Yeah, thank you so much for taking the time to join us. You're more than welcome to share your cameras if you want to. You don't have to. It's completely up to you. But we would just kindly ask that you can keep your sound off. There will be a chance for any questions later. Just so we don't get any interference in the background, that would be amazing. But it's lovely to have you all here.
Looking at you, Meg, your dog's locked away.
Yeah, I know. The dogs are locked away. They normally like to join me on the webinars in the evening.
And Grace and my child is locked away, so we're all good to go.
Yeah, we're rocking and rolling.
Just the husband's been I need to worry about now.
Yeah, locked them upstairs with the dogs.
Well, the numbers are going up by the second, so should we give it another minute or so, do you think?
Yeah,
another minute. Can the sound be a little bit louder? Ooh.
I don't think we control the sound, do we?
No.
I think you control that on your device, on the device you're on.
I think that's it. We're as loud. Will it be shared?
Yeah, it'll be shared this evening.
So just another quick one, because we've had a few people join us. Welcome to our webinar. Thank you so much for joining us. Just another one just to say you're more than welcome to keep your cameras on if you'd like to, or you can turn them off, whatever you'd prefer. But we do just ask that you could keep your sound off just so we don't get any interference whilst we are presenting, if that is okay, pretty please.
Amazing.
And it is being recorded.
Yes, it is being recorded and should be shared later. I think what I'll do is I'll start sharing my screen now if we're happy, guys.
We still have,
yeah, I think so.
We do still have tons joining now by the minute.
Okay, 1 more minute.
Maybe 1 more minute.
I reckon 1 more minute. That's it, and then
final
we'll get
countdown.
Absolutely. They're counting to song, Grace. I dare you.
I can't remember the action that she does.
No, I can't.
What, the final countdown?
But Megan, I know you, and I know you're holding back so much now from like breaking out. Maybe
at the end of the webinar we'll get some dance moves out.
I cannot believe how many of you are joining us. This is insane.
Amazing. It's great to have you with us.
It is.
Fabulous.
I imagine as we get cracking, there'll probably be some more joining, but I think it's a good start.
It's being recorded, so if people want to watch anything that they miss back, then you're more than welcome to sort of log on and have a little look at things if you miss anything. But I think it's probably good that we get started. So I'm going to share my screen.
Just one other question box, sorry to interrupt, Meg. Joan has said she's having a problem with sound. If you have a look, we might be muted. So if you have a look, or have a look at the sound on your device. And yeah, there's going to be a presentation on the screen.
Right, I'm going to start sharing my screen now. So there will be a presentation on screen. So my screen should be shared now, and hopefully you guys can see. Let us know in the question box. I can no longer see the question box, so ladies, you're going to have to
I've got it up. I'm monitoring.
So can everybody see my screen?
Yeah,
you can.
Oh, and Jen. Sorry? Ladies and gents. Thank you, Aaron.
Right, are we ready to begin?
Yeah.
Fabulous.
I think so.
So as promised, we're going to be discussing polynucleotides versus Profhilo. Polynucleotides tends to be the buzzword of 2024, which I'm sure everybody has been aware of. So we're going to be discussing a little bit about polynucleotides, a little bit about Profhilo, touching on some marketing, because after all, we all love to learn how to market these products. And we're just going to be discussing them both in depth. So hopefully you can learn a little bit of something that you didn't know before, and hopefully take away some useful tips as well.
And for all the people that have seen the hashtags salmon sperm facial, trout sperm facial, this is being covered.
Yes, definitely. So just to introduce us, and the Nurses Network. So if you're wondering who we are, so there are three of us. I'm Megan, and we've got Kate and Grace. We'll introduce ourselves a little bit more in depth in a moment. So we all own businesses. We're all in the aesthetic industry for varying amount of times. We have a membership platform that is a support network for other medical professionals, not just nurses. And we are aiming to support and guide people through their journey in aesthetics. As we know, it can be an overwhelming and very lonely place to be. So that is what we're aiming to do. So moving on, we'll just start with Kate. So if you'd like to take over, Kate. Kate? Hello?
A couple of people have said about the feedback. So I think if we make sure we're muted, and that obviously we'll make sure we're muted as well at the same time, because there was a bit of feedback, I think, coming off when you were speaking there, Meg.
Oh, fab. Okay. I don't know if I can mute myself, so I might have to say.
Yeah, on the 1 sec. I'll do it for you. There you go. I'll unmute you. You can unmute yourself very quick, but I'll unmute you in a minute. So hi everyone. So obviously I'm Kate, 1/3 of the Nurses Network with Megan and Grace. I have a clinic down south called the Clinic by the Ross. Ignore the accent. It's a CQC registered clinic, and we specialise in non-surgical and surgical treatments as well. And I also own the two training academies, Urban Training Academy and Urban Training UK. So I've been a regional trainer for Tioxane now for some time, and a trainer for polynucleotides for about 12 months. My background is obviously I've done my bachelor's, PGC, postgraduate degree in education, my master's, and more recently my level 7 in independent prescribing. Full disclosures, obviously I'm a KOL for Dermalux, work alongside Neogen, and I'm partnered with a clinic in Scotland as well as surgeons in Manchester, London and Italy. So for me, I can speak for the girls as well when I say this, polynucleotides is very close to all our hearts, in the sense that regenerative medicine is a big part of what we do. In fact, last Sunday, and I wasn't under the influence of alcohol, I decided to enroll in doing a PhD in regenerative medicine. So God knows why, but that will be a lot of fun. But we're all so excited about tonight. So as we start going through some of the questions, we should unveil more. So I'll hand you over to the other girls as they introduce themselves. Why is it muted, Meg?
I don't know. I can unmute myself, but I don't think Meg can.
Let me have a look.
You stopping the muted? I have no idea. It won't unmute her. Megan can't speak. Oh no.
Oh, I can hear you. I can hear you.
Hello?
Yay.
Going well. It's going well so far.
Yeah, technology.
Right, let's just not mute Meg.
Yeah, just don't mute me, because I have to present as well. So I'm Megan, in case you didn't guess, or Meg. So I qualified as an adult nurse in 2017. I am the newest member into aesthetics of the group. So I left the NHS 2 years ago, the good old NHS, and I've been working in aesthetics full time since 2019, and I've never looked back. So I own a clinic in Norfolk, and I am, of course, a co-founder of the Nurses Network. Full disclosures, as we said, I'm an ambassador for 3D and Dermalux, and my clinic focuses on regenerative medicine, skin health and skin science, and I, alongside Kate, do some training as well for Dermafocus through the Nurses Network. So that is me in a nutshell with a lovely photo there. So moving on swiftly to Grace.
So I am Grace. I have been in aesthetics for nearly 9 years now. I am in Wales, so wrapping the Welshies, there's not many of us. I own a Zero Aesthetics and a Zero Aesthetics Academy. My full disclosures, so I am a KOL for Chroma, so I train their polynucleotide range, and I also train for their lip range. I have completed my non-medical prescribing. I'm partnered with Neogen and with the Observe facial skin scanner and a health exchange. And that is me in a nutshell.
All in nutshells.
All in a nutshell.
So moving on a little bit into kind of starting with polynucleotides. So I just wanted to focus more on the background around why we maybe might think that polynucleotides and regenerative medicine are becoming more popular. I know in my own practice, and certainly some of my other colleagues' practices, there tends to be a definite drop-off in people seeking large filler packages. They want more natural enhancements. They don't want people to know that they've had work done. You know, even bruise, people start to panic about. And there definitely tends to be more concern over skin health and skin science, understanding that everything, you know, the skin is your largest organ on the body, so you need to look after it, you need to respect it. And I think there's an awareness, certainly there's been lots of published articles quite recently. There was one definitely with Alice Hart-Davies that we all or might all be aware of in terms of how long filler can stay in the tissue. It was with an MRI scan looking at dermal filler in the tissue up to 15, 20 years that can be there, which is all well and good if you've had amazing work done, but it's just more understanding of the general public of long-term effects of dermal filler.
I think a lot of our techniques have changed as well, and the fillers have evolved. So things that I know certainly in my practice, things that I was trained to do back 9 years ago, I wouldn't necessarily do now. If, for example, the way that we focus and treat a lip, if we were routinely taught to fill the vermilion border, which we now know has caused migration. So you see lots of people now wanting to remove fillers and wanting to go more down the more natural route. And like Megan said, focus on their skin, their quality, and preserving and enhancing what they have rather than replacing or putting in an artificial product.
I think if I'll just add in really quickly. There was this year a friend of mine published a really great article, and it was about the fact that when they did a massive big data poll, it came up that the reason the majority of people are moving towards regenerative medicine is also down to the fact that people do not want long downtimes. And even though for the majority of us, dermal fillers don't necessarily bruise and there isn't a lot of downtime, I think when we're trying to chase skin treatments and we're looking at predominantly standard skin treatments, I think a lot of people feel that there is a lot more downtime than the future, I guess, with regenerative medicine. So I don't know if there's a lot of truth in that, but that was a recent publication which was worth reading.
Yeah, definitely. That's really interesting. I'd be interested to read that as well, Kate. So we just wanted to go through some myths that we have all undoubtedly heard in one time or the other. I know that there's a lot of confusion with polynucleotides. I know certainly in my practice, people are like, that fish, what's it? Majig. So, it's quite difficult to I think there is more understanding as people are going on television and advertising this product, and people are starting to get to grips with what it does and how it works. So it is not a skin booster. Surprise, surprise. We will touch on those a little bit later. It is a skin primer, so it should be utilised to really prime the skin before you go into using other modalities, such as dermal fillers, lasers. It really primes the tissue and gets it ready and in the best condition that it possibly could be before you're utilising other products on top of or as well as. And it's been utilised actually since 1986 in medicine, so it's not a new idea. It's definitely been used for fish skin. I've certainly seen it in my career as a nurse. I don't know about the other ladies, but yeah, it's definitely something that hasn't it's not a brand new concept. It might be new to our aesthetic medicine world over here, but it's definitely not a new concept.
I even think it's been around in aesthetics for about 20 years.
Yeah,
absolutely. But I think the key is the reason I think we've got Gordon Ramsay losing his temper there in the background is I think as all trainers for polynucleotides in one capacity or the other, I think it's really, really important that as practitioners we get our language right, because if we don't understand the modalities that we're dealing with, ultimately we're just going to confuse our patients. And I think when we talk about skin boosters, we are talking about boosting hydration, and to say that a polynucleotide just boosts hydration is ultimately the biggest offense on the planet, because that is so much more than that. So I think we'll get cracking and unpick that a little bit with this presentation, definitely.
Yeah, definitely. We'll go through everything. So have another myth here and another meme, of course, because we all love a meme. So no, they're not just a filler. They're not fillers at all. So they're classified as a medicine. They're dose dependent, they're fully absorbed by the body, unlike dermal fillers, as we well know, and people are starting to understand a little bit more now as well. And it has a half-life similar to a medication. So it's a lot more complex than we think. And I think the real dose dependency is really important when understanding how to treat the face and different areas of the body, and why you would utilize one product for one area and one product for another, rather than just going rogue with it, really, because I think that has been a misconception as well, because people they go, oh, it doesn't cause a vascular occlusion, or it shouldn't cause a vascular occlusion, so just go rogue with it. So I think that's something that we need to change as well.
100%. And I think, do you know what, that's something that I drill in when I'm teaching it, is in the sense that when we think about medicine and we think about a mode of action, how it achieves what it's meant to achieve, as practitioners, we really need to educate our patients to kind of use that language, because they need to see the difference. And when I say to people, when I start to try and explain that, it's not a quick response with polynucleotides, I know we're going to delve deeper, but I always use the example, seeing as though we're just referring to it as medicine, as if you've got high cholesterol and we put you on a statin, you're not going to see that change straight away. And it takes time for that biological response. And this is the same with, it works on the receptors, the A2 receptors. So we need to consider that and treat it like that when we're considering, what it does and how it achieves what it's meant to achieve. 100%.
For people that aren't sure what to call it, I know that's probably a question. In my clinic, we call it a DNA-derived drug instead of a skin booster. We talk about it in a DNA-derived drug and go down and explain what polynucleotides does.
That's a really good thing to call it, definitely. So moving on, so going through polynucleotides, no surprises there. So just to touch on what are they, so Grace briefly discussed the salmon sperm facial. So salmon or trout, we don't discriminate around here. So as I touched on earlier, it's a skin primer, so it should be utilised prior to other treatments or alongside, as I said. So touching on some of what it does, and we'll touch on more of that later. So it increases the rate of cell proliferation and enhancement of fibroblasts, those amazing fibroblasts, those collagen creating fibroblasts. And it doesn't only do that, it's pre-adipocytes, so your fat cells. It can maintain water balance within your face as well. And like we said, it can come from salmon or trout as well, dependent on what product you are using. So yeah, that's a basic through.
When polynucleotides first came out, it was heavily dominated with salmon. We have switched to trout now, and Mastelli products are trout, because trout can survive in controlled waters where the salmon had to be wild when they farmed them. So we found that we were running out of stock, because obviously you can't control wild salmon, and salmon are also wild salmon exposed to pollutants and other metals in the water. So they switched over and started using trout, because trout can be farmed and they survive in sweet waters, so they can control what they're exposed to, so they can control better the quality of the product. I think all three of us use predominantly trout in our practices because of that reason.
Yeah, definitely.
Yeah, but I think when I was doing that clinical paper last year, though, I did notice a response in the inflammatory response that you get straight after when comparing the salmon and the trout. There is a clear difference. So it's quite interesting to see. And I think we did that in about 400 separate treatments, and it was very obvious the difference. So there is a difference.
I think touching on inflammation and inflammatory response, it kind of really highlights the need to look at how many milligrams per mil your product is as well, because if it's too heavily concentrated and you're utilizing it in an area such as the eye, you are more than likely going to get an extreme inflammatory response as a result of that as well. It's really weird because I can't see anyone because I'm presenting, so I'm finding it very strange. I just feel like I'm here on my own.
We can see your lovely face.
So these lovely slides here, I know that slides can be, or slides, graphs, not slides, graphs can be a little bit confusing. So just to kind of break it down, so this goes and looks at fibroblast activity and the number of fibroblasts. So number one, I think you can see a small one there, is fibroblast activity levels. So on the left-hand side, you can see after 96 hours, you've got a control, and then you've got on the right-hand side one with polynucleotides. So you can see that the activity levels there's a massive change there between the control and those that are stimulated with polynucleotides. And then after that, on the right-hand side, you can see that they are still massively elevated even after 1 week, which is just amazing that the activity levels are enhanced that much. And then on number two, just down one, you can see the number of fibroblasts. So not only has it stimulated the activity levels, it's also stimulated the number of fibroblasts, again at 96 hours and 1 week. So yeah, it's quite incredible really to see it demonstrated in front of your eyes.
We've got a few questions just surrounding this slide. So it's not a crazy question. The question regarding vegans, essentially no, vegans wouldn't want to have this treatment because obviously it is using a byproduct of an animal. It is a byproduct, so it is the gonads, but it's still comes from an animal. We have a couple of vegans in our clinic who have chosen to still have the treatment, but I think you need to be very clear with them that it is a byproduct of obviously a fish. And the other question about the fish allergy is if a patient has a known fish allergy, this is not a life or death treatment. This is an elective treatment. I don't think personally I would put a product in a patient derived from fish if they have an allergy to that product, because this is an optional treatment.
No, and I think with the other thing, especially if you focus back on our podcast, girls, I think this was something that Sylvia discussed from Dermafocus, and what she was saying is, and I think we get this, anyone in the medical world will know, a lot of people throw the word around allergy, but it's whether it's a true allergy or that's a whole new ball game of assessment. So I think the key is, yes, you can go down the road of, you can have a patch test under your skin to see if you have an allergy to it. But like Grace said, if someone is adamant that they've had an allergic response, the adamant is allergic response, then potentially stay clear from it in the first place. What is the podcast? Oh, sorry, we're just referring to our podcast as the Nurses Network. We have a podcast that we run alongside our friends at Acre, and we interviewed Dermafocus, for example, and we discussed polynucleotides. It was just the one that was launched this week, so it come up to my head.
It's a watch. It's a good watch.
Yeah, it's really interesting as a follow-up to this.
What was this question? Will you discuss polynucleotides combined with HA? I think we've actually got a slide for that, so I reckon
we do.
We'll probably churn on, because if we keep stopping for questions, I reckon we'll miss. But I'll keep an eye on the questions.
Slides.
But I reckon we'll probably move on to the next slide if possible, Meg. I love this.
Yeah, so it's really interesting. So this is a scratch test. So it's under a microscope, so you can visually see the number of cells that have been stimulated by polynucleotides. So you can see the fibroblast proliferation right in front of your eyes under a microscope. It's quite incredible, the number of cells that have been produced. It's just, yeah, mind-blowing. I always find it just amazing. I always find that when I'm doing a treatment, having the science behind me makes me feel really happy. And sometimes I will actually just get this slide out and be like, isn't this amazing that these fibroblasts have been stimulated by this product, and this is all collagen producing? And yeah, it gives patients confidence as well, because I think sometimes when a product can take a little bit longer to see results, sometimes it's nice for them to be backed up by the science as well.
Definitely.
I'm just gonna jump on there because we've had a couple of people just responding to the previous statement. So the answer to the question where it says Dermafocus said that sterilized allergy would not occur, the key to mention is we can only go off what the data tells us, and as in current dates as we look now, there has been no allergic reaction, no evidence to suggest that someone will have an allergic reaction. There has actually been case studies where they have done it and there has been no reaction. What I think Grace was saying is, because it's an elective treatment, if you have a patient that is predominantly anxious because they have had a severe fish allergy before, there are other options. I think that's what we're trying to say. I think anyone who knows me personally knows I'm allergic to my own shadow, and sometimes I have a tendency sometimes to kind of almost, I don't want to say imagine an allergy, but I get very anxious about doing new things in case I have an allergic response. So I think the key is if you have a patient who's had a severe allergic reaction to something, then there are other options, because it's probably not going to be a pleasurable experience. It's not life or death. There are other options. So I think that's where Grace was coming. As we know right now, there has not been a case of allergy to fish because of the way that the product is sterilized and medically filtered. I think also one thing to say here is be very, very careful about the certain manufacturers of polynucleotides, because the process of manufacturer sterilization and the medical process of that certification has to be certified medically, as in assessed. The mass sterilate and bioformula, I can only comment on those because obviously that's who I personally have had dealings with, and both of them have had stringent tests in that sense. So their processes have been controlled and verified. I think, as with anything, you have to be careful because there are always going to be lots of products on the market. But just to be clear, just so there are no misunderstandings, there has not been a single allergy so far for a person on polynucleotides who are allergic to fish. But like I always say when I talk about anything, never say never. Until last year, we never knew that someone could have a VO having a botulinum toxin treatment, but we had our first case last year. So I think we have to be very, very careful to make big blanket green light statements and always lie on the right side of caution. And again, in regards to somebody saying you can have an allergic reaction on second exposure, absolutely. But we have to also be mindful that we as practitioners can never, a VO is a vascular occlusion. We as practitioners cannot diagnose someone with an allergy. That is the job of an allergy clinic. So if somebody says, can you do an intradermal patch test or a patch test to see if I'm allergic to something, we can. It might give us some kind of an indication, but it certainly won't give us a green light or a red light. Even people do the same with hyaluronidase when they want to treat with a patient with a dissolving treatment. Again, it's not a green light. It's a measure that we can take in the parameters of our clinic. So if you have someone who thinks who's comfortable having it, but is a little bit anxious, hasn't had an allergy before, but it's just a little bit unsure and wants to have a little bit under his skin, is that going to do any harm? Would I do it? No, I wouldn't. But we're just discussing the issue. I agree. Again, the allergy is to shellfish. This is what we were saying earlier on about what is a true allergy and what people would say is an allergy. So I think we could go on forever about allergies.
About the shellfish, I actually contacted the provider about that, and they have said that obviously, as you've pointed out, Aaron, a shellfish allergy is very different to a fish allergy. If somebody has a shellfish allergy, it doesn't necessarily mean they're going to have a allergy to this. And as Kate put greatly, if we all have medical PINs, we have a governing body to answer to. If we have somebody who has a severe fish allergy and they were to be unfortunate enough to have an allergy after this allergic reaction after injecting this product, where would we stand when we do have alternative treatments on the market?
Definitely.
Yeah.
Right.
Cool.
Next slide.
Let's crack on.
So again, this is just about increased collagen synthesis, so type 1 and type 3, so 2 different types of collagen there. So again, just shows you the control and the polynucleotide on collagen type 1, and then the effect on collagen type 3. So just shows that they are significantly increased after 1 week. I'm going to move on because otherwise I think we're going to be here for ages. So this just shows tissue repair. So you've got the control on the left-hand side there where tissue repair is incomplete with a lack of collagen fibers. And then you've got hyaluronic acid, so just hyaluronic acid on its own. So we could kind of compare it to Profhilo or some skin boosters. So tissue repair is not complete there under the microscope. Collagen fibers, yes, there are some, but not many. And then on the very right-hand side there, you've got with polynucleotides, and tissue repair is almost complete with more collagen fibers. So again, just a direct comparison between the two.
And if anyone's wondering what HPT stands for, it's one brand and Mastelli's highly purified technology. So it's still polynucleotides, it's just with their highly purified technology.
Thank you. So again, this is just a focus on collagen fibers. So it goes through the same image that you've seen before, but just with a focus on those collagen fibers with the tissue repair. So this is a direct comparison, so you can see the collagen fibers under the microscope there. Don't know if anybody else has. I'm not going to read all of that on the left-hand side because
I think that we can change the collagen, but I think the easiest thing to say is, especially with our patients, we have a lot of patients who are menopausal as well, and I think we need to just be we need to consider the fact that we lose collagen at such a level. I think it's 1% a year once we hit like 25, 26. So I think it's really important that we consider more than just hyaluronic acid and these things. Collagen is really important. So if we can increase collagen fibers, that's going to reduce transdermal water loss. That's going to improve laxity in the skin, luster of the skin, the overall functionality of the skin. So we're not talking just about the aesthetic benefits, but also the functional and fibrin of the skin as well. So I think it'll really help. And I think I've got a feeling I know what the next slide is, and I think it's a really good one about the dermis, isn't it, Meg? Or am I lying?
No, this is just a touch on what regenerative medicine is.
Can I just want to know the statistic that I thought was coming? Literally one line. In 30 days of using 20, I think it was 20 milligrams. I think it was 20 milligrams. It was 52% thickness in the dermis after 30 days. So I think there's some incredible data out there that really verifies the benefits of using it, which is great.
Definitely.
Yeah, one thing that just to mention as well that polynucleotides also can do is promote scavenging of free radicals. So it has an antioxidant effect within the skin, as well as obviously stimulating collagen, increasing fibroblasts. So it is much, much more than a skin booster. It deserves its title.
Definitely. So obviously we know that it falls under the category of regenerative medicine. I did just click over that slide and I can't figure out how to go back. So this just goes through a little bit about Dermafocus and Mastelli products and how they are produced. And I think we've kind of gone through a little bit on that process, Kate, when you were talking about allergies and how they're sterilised, so medically sterilised from raw materials, and where they come from. So they're like an Italian product. So that's just a little bit about that.
Mastelli being the originator of the technology as well. I think that's important to kind of give them that title.
One thing that patients can sometimes ask is how it's purified. Unfortunately, even we don't know, the distributors don't know. It's covered under industrial secrecy by Mastelli. So we don't know. We know that it's got highly purified technology and it's got 70 years of research, but we don't actually fully know the process because that is covered by industrial secrecy.
Definitely. So this moves on to biological effects. So like we said, it's not just a skin booster. It has far more effects on the body than just helping with fibroblast cells. So it helps with cell proliferation, it's regenerative, synthesis of hyaluronic acid, so we have touched on that as well, synthesis of collagen and elastin, and so it induces angiogenesis. So it helps, can also help with sort of melanocytes inhibition, and has an anti-inflammatory effect as well. So it can help with patients that have hyperpigmentation, if anybody has rosacea or any issues with inflammatory issues with their skin. Again, it can help with aging skin, like Kate rightly said, with the menopausal skin. We have lots of issues with that as we get older that people aren't really talking about. There's also a whole range of sort of vaginal rejuvenation products that can massively help with menopausal women as well. And we also have now the crossover between polynucleotides and HA products, which kind of touches on both. So they do far more than just stimulate those cells that help with collagen. I don't know.
And just to pop on some of the questions quickly, because we covered this slide. Yes, used for acne scarring, great for acne scarring. And for the person that's mentioned about the under eye edema, no, unfortunately, this wouldn't improve under eye edema. It could actually slightly worsen it, obviously, the synthesis of the hyaluronic acid. So
somebody mentioned as well, though, about, they said, I've been doing polynucleotides and I've had a client who said she had puffiness after Lumeize. Just to make it very clear, when we talk about polynucleotides in its linear form, we're talking about polynucleotides as a fully absorbed regenerative medicine. When you talk about Lumeize, that it has been kind of categorized as a polynucleotide, but it's not a linear. And what I mean by linear, it's polynucleotides with something else, and we have to be very, very careful about how we're treating them. When we talk about, even if we just because we've talked about Mastelli range, Mastelli will do products that are only polynucleotides, and then they will do what they refer to as hybrid polynucleotides, where they mix, essentially they're cross-linked with hyaluronic acid. They reduce the molecular weight of the milligram polynucleotide to account for the hyaluronic acid, so the molecular weight is balanced at the end. So it's really, really important to know that if you get when you're treating with the periocular region, hyaluronic acid isn't necessarily your friend. So if you've got to consider the fact that it's literally a few millimeters thick. We don't need to be adding hydrophilic products in there. Yes, we can get away with it on the right candidate at the right time. But if you're treating a patient who's got any laxity or is failing a SNAP test or is a negative vector, and you're pumping a HA-based product in there, you're asking for problems. And that's because of the HA element of it. It's not necessarily to do with the polynucleotide. The polynucleotide will synthesize some HA, but the HA that you're putting in is just going to take that to a whole new level. So Lumeize is slightly different to what we're doing. And then you're saying about microneedling. Polynucleotides are roughly around 1500 kDa, so the molecular weight is too big for it to be microneedled in. So just people use it sometimes as a base to use as a lubricant for microneedling, but the actual majority of the products out there, the molecular weight is too big. It's just not going to absorb. Sorry, I had to chirp in.
That's fine. We keep moving.
We're all here to be teaching, definitely. It's not just me. Thank God. So talking a little bit more onto safety profile, we won't stop here for too long. So allergy, as we've discussed already, we've touched a little bit on lymphatic drainage. So obviously some issues, if you were to mix it with hyaluronic acid, you can come across some issues with lymphatic drainage, especially around the malar region or the ocular region. So there's been over 1 million treatments, probably far more now, and no adverse responses as of yet. It is not a gel. So normal pre-injectable advisories would be what we would suggest or what the products would suggest. So bruising, bleeding, swelling, infection, allergy, what you would normally go through with your patients before you inject them. If the ladies wanted to add anything.
No, we're all good. Let's keep it moving.
So this just touches on uses, areas, and obviously multiple modalities, because we've gone through the fact that polynucleotides are skin primers. So yes, you would utilize them, or you can utilize them alongside other modalities. This doesn't touch on machines and things like that. If you have those in your clinics, then obviously they're more, more things to your belt there that you can offer your patients. So just to go through perioral, so you've got Plinest, like I've said, to prepare the skin, so thickens the dermis, and then you can consider other products that you would utilise. Periorbital, Plinest Eye, so it's got a specific product, slightly less milligrams per mil, just to help with any lymphatic drainage and also prevent any inflammation or too much inflammation of that area. It's a very delicate area. So it helps with hydration, pigmentation, laxity, and then you can address any volume loss after they've had a full treatment of polynucleotides. And then to have a little look at mid-face, so again, we utilise Plinest products, so to improve the skin tissue, thickness, hydration, everything that we've previously discussed, and then you would look at your volume loss. So you may find that you need less dermal filler, and you can address different areas. And then décolleté is Plinest, and chest and body would be Plinest as well, which is what we utilise.
Can I
just for those, sorry, Kate.
Can I just say, sorry, but one thing I will say is this is, we are referring to Plinest because that is what we tend to use, as in Megan and I, and Grateful use Chroma. What I want to get in very, very quickly is we should make this a little bit clearer. So apologies, because in the reflection I just thought, what's important is that you don't necessarily focus on the box, focus on the milligram. So when we talk about Plinest Eye, Plinest Hair, we're talking about 7.5 milligrams per mil. When we talk about Plinest or the other, if you go onto Flanage and there are other brands, we're talking about polynucleotides as a generalist. We're just so when we're talking about, for example, periorbital, we might say that we'll look at 7.5 milligram. When we talk about mid-face, we might want a little bit higher milligram. When we talk about décolletage and don't we want a slightly higher. So it's just to get that in there. We're talking about milligrams. Really? And somebody mentioned there about the Profhilo is not linear HA, and your comparison chart was on linear. The comparison is about polynucleotides as a general, and we're comparing it with linear. We're going to compare it with Profhilo shortly. Profhilo isn't linear because it's high and low molecular weight. I understand that, but the chart that Megan was referring to before was a data where it was compared to linear. We're going to compare it to Profhilo shortly. So sorry if there was any confusion.
Yeah. So, and if there's any worry as well, what I would recommend is whatever product that you've been trained on or you utilize, same as us, contact your rep or contact Acre Pharmacy, and they can point you in the right direction of what products to utilize, or who could help you decipher what products to utilize in the range that you've been trained on or you choose to utilize in your clinic. This is just what we choose to utilize. So just to go through some case studies. So I think it's yours first, Kate.
Amazing. So this was on my patients, and the reason I like to share hers is because a lot of people focus on the neck changes. Actually, she had such a significant change in the laxity of her neck, but we didn't actually treat her neck. We treated her face. So I always love you throwing this one in. Although I have even better case studies, I like that one because it made such a significant change to that area, and it just shows the lifting capacity that polynucleotides have. So this polynucleotide was for a case study that was published last year of mine, that got published in the Aesthetics Journal, and this was about combining polynucleotides. And yes, we did. I used the Plinest range from Dermafocus for this particular case study, and we combined it with Dermalux light therapy. So they had the polynucleotides and light therapy after their session. So this is what this was. She had 4 sessions to the face, a combination of needle and cannula, and you can see the impact. Her whole skin texture changed, and the lift on her neck was astronomical, and that was from treating her face. And I throw that one in because it has such a I just find a lot of people go and comment on the neck, and actually we didn't treat the neck. So it goes to show what kind of a lift it can have, and in those secondary areas you can see the improvement too. The next one I will show you, this is one of my faves. So this it's not showing up really clear there, but I can by all means send these pictures out to anyone. This was a patient. She's actually insane. She looks beautiful anyway. She's aging insanely well. She's in a mid 70s. And we treated her face and neck with Plines polynucleotides, and we used a combination of cannula with the face and a needle on the neck. And she had unbelievable results to her face and neck. No filler was used, only polynucleotides and light therapy. To answer your question, I put them on post-treatment 10 minutes. And if they were having an individual treatment, they'd have it 20 minutes. Post-treatment, you have to tailor it. And we're not going to make this a session about dermalux, but essentially, I don't want to take the inflammation away. We want erythema, we want inflammation. So I don't use the NAR light. Sometimes I'll just use an element of the blue light because we're using lots of boluses, lots of injections. So anything that's going to have an antimicrobial effect is great for risk aversion. And then I'll use red light because I want to further push and synthesize that collagen. So on the neck, I always use needle, little boluses. And on the face, I tend to use a combination of cannula and needle. Grace and I went to Rome last year for one of the regenerative aesthetic conferences. And a lot of the surgeons there, it was a real debate about whether cannula is better than needle. And I think the key is find your way. The research tells us that bolus is better. That's what it says. The reason I tend to use cannula is for those patients who potentially don't tolerate it very well, or I feel are slightly less able to heal as quickly as others. They'll put it like that. So I may then use cannula, but the evidence does tell us that bolus is a better result because of the proximity and the stability with that placement. And then I think that is it for mine, isn't it? Or have we got one more? Oh yeah, that's the patient from the front. So that's, you can see. I mean, look at her. I mean, she looks bloody amazing for her age anyway, but you can see there a better angle of the neck. It sharpened up her jawline. Her face looks brilliant. And actually just a general complexion changed. And again, an improvement in the overall lifting of her face. One thing that this doesn't show is on animation, she used to suffer quite badly with rhinitis and smoker's signs, and after this people actually thought she'd had a filler because they'd completely eliminated, and she didn't. There was no filler in between these images, but it was just a beautiful natural enhanced result, which is exactly what she wants, because she's nearly 80, which annoys me as well because she just looks so good. Like, oh my god, like come on, woman, she's great. But her results were fantastic, and I think that was it. Is it? Have I got sneaky one more in there?
Yeah, this is me.
Oh yeah, your results, Megan, for skin are just my favorite. I absolutely love it. I love it.
So this was one of my beautiful patients suffering with rosacea for years. She felt like she'd got a slight handle on it with skincare, but not seeing any improvement like this. And then I said, well, I've got this new thing here and I'd like to try it. So yeah, we did 3 sessions of polynucleotides, and they were 3 weeks apart, and that was cannula and needle approach, mainly needle approach. And she's just had an incredible result on the inflammation around her skin, and she is just, yeah, she's so happy. She's since had a couple more sessions, and yeah, she's over the moon. She's never had skin like it, so yeah, that makes me happy. And then just under eyes, so hollowing under the eyes, I've seen a massive improvement on a lot of my patients who wouldn't necessarily be candidates for teardrop filler. This lady probably would have been a candidate to be fair, but she didn't want it. So we decided to go ahead and utilise polynucleotides, and she was very, very happy with the results, and I'm super happy as well. So yeah, I'm very, very, very impressed. Even if I do say so myself. This one was a rosacea. Again, this lady's rosacea is quite bad. She's had, again, skin treatments. She's tried lasers in the past. She's tried a lot of different things. So we tried 3 sessions of polynucleotides, and although it hasn't cleared her rosacea, it has got a handle on the redness, and she said that her skin actually doesn't feel as sore, and as she's not as aware of it when she puts her makeup on in the morning. So anything I can do to help just, again, brings me joy. So yeah, she's seen a massive improvement, the inflammation in her skin. And one more before you get bored of me. So this lady was a full face treatment, and again 3 sessions. I believe actually this one was only after the 2nd treatment, and she just had a massive reduction in fine lines. Her pigmentation was improved, and around her jawline was improved as well. And yeah, she was just blown away by the fact that it was so quick as well, the change in her skin. So very, very pleased. And that is me. On to Grace.
So I wanted to cover something slightly different, so I decided to show you some hair results, as obviously the hair products have only recently been launched. So this was the protocol recommended for the hair treatment, which is 8 sessions in total. The first 4 treatments are recommended weekly, and then the remaining 4 are following the regular protocol of 21 days apart. So this lady, this was after her 7th treatment, and you can see the difference in the hair follicle growth, the hair quality, and she found that she when she washed her hair, she wasn't having as much hair shedding, she was noticed, and her hair was just better quality. You can go to my next one, Meg. I can't click, sorry.
No, sorry. I was just staring at the hair.
That's fine. A lot of the questions have been around the hybrid product. So I wanted to pop this lady in because she did have the hybrid product with the HA. So the hybrid product, is important to note, doesn't have quite as higher dose as polynucleotides. So the hybrid only has 10 milligrams a ml rather than 20 milligrams a ml, but it does contain 10 milligrams a ml of the hyaluronic acid. It also contains mannitol. So mannitol has an antioxidant effect, and it's a natural cross-linker. So it can reduce your degradation of your HA by about 34%. So it takes it for the product, the HA in the product lasts for around 5 days post-treatment. So what's important to note is if you did want to use the hybrid product, we know that obviously the HA effect from injecting HA can last up to 6 weeks. So you wouldn't need to use the hybrid product on every single treatment. What you could do is sandwich this. So you could use the polynucleotide hybrid. You could then use the 20 milligrams a ml, 40 milligrams in 2 ml product, and then you could use the hybrid product again for their 3rd treatment, if that makes sense, so that you have the benefit of both of the HA and the stronger concentration of polynucleotides. So this lady had that exact product. She had a sandwich treatment of a mixture of the polynucleotide 20 milligrams and polynucleotide 10, and this was injected intradermally. So I've seen a lot of people asking what depth. So you want to be as intradermal as you can be. So this is why we like using a invisible needle or a 4mm needle, just so you can make sure that the blebs are intradermal. You can use cannula, obviously, but just you want to make sure that you are intradermal as possible for the best results. But you can kind of see the improvement on the lady. If you look at her jowl, her fine lines, the same as Kate and Megan's, the skin texture and tone, it just looks hydrated, healthier. And I think I've got one more.
You know what? Even if you that picture, you could even see a change in her temple region. That just again, it just shows like how amazing the lifting capacity is with look. Can you see the change in the temple? Even that looks improved.
Yeah, no, definitely.
I just love polynucleotides. They're insane, honestly.
And then my next lady, this is my final one. She is somebody who I did add in. She did have a small amount out of mid-cheek, but she predominantly wanted to treat her nasolabial folds, but because of her movement and the depth, I didn't think it'd be suitable. So we decided to treat the hybrid product on the same protocol, and you can really see the difference in that almost volumization to her nasolabial folds. We got her in the same position and smiling the same to show the difference in the depth, but you can also see her skin quality, her texture. The skin looks brighter, smoother, and obviously the depth of those right eyes just isn't as bad. That is me.
So this should have a little video, there we go. So hopefully this is just injection technique. Hopefully it will play. Oh no.
It was just playing, Meg.
Was it?
Yeah.
Oh. How do I get it? Maybe it might just come up.
It might have to, because there's a 5-minute warning on this meeting.
Is there?
Mm-hmm.
So just skip it?
So essentially what this slide is saying is that you can use a smaller needle so that you can make sure you stay intradermal. So you can use a 4mm TSK invisible needle or a cannula, but you want to be intradermal. If we think about where predominantly the amount of our fibroblasts are, obviously they have them in every layer, but we want to be with those fibroblasts. So you're using superficial blebs and covering the area that you want to choose.
Thank you. And then this next one was just all about cannula and how to utilize cannula. So it's exactly the same. I don't know if it's playing or not. Yeah, just making sure that you stay intradermal with your cannula and you stay in the same layer to really have an effect on those fibroblasts. And should we move on? So this is just about marketing. So it's just a quick whistle stop, but obviously I don't want to run out of time. So just if you're happy, you can take some photos of this just to kind of try and help you, because obviously we go and we do our training and we feel like we're equipped, but I find that it is quite difficult to really know how to market these products and how to make sure that our patients are understanding what the products do and how they work. So just making sure that, you know, you're getting your case studies, you're getting them in and you're getting your photos so you can really utilize and showcase your work. And addressing your demographic, so understanding your demographic, looking at your target audience and understanding who they are and what they want and why they might want that. And then you can address them, popping questions on your story, for example, popping little polls out, or sending a mail out to your patients, doing teaching every month, utilizing your booking system to, you know, get their emails and do a mail out that way, or utilizing your social media to do teaching on that, so people really understand what the product is, and combining your case studies with a reel to educate people. Utilizing Canva, it's really, really simple to create these photos before and afters, or like a little carousel post so people understand it, and then, you know, use a direct comparison. How is it different to Profhilo? How is it different to other products? I don't know if anyone has anything to quickly add. And then just what I did quickly, so coverage prior to training, I made sure that I was advertising polynucleotide treatments, what they were, making sure people understand what it was. And then I did offer a giveaway on my page. So it got people excited, it got people sharing a reel. And I offered model days to get bums in seats so I could get treatments going and people could really understand what the treatment does and how it works. So how to introduce it to patients, going through making sure that they understand it, like Grace said earlier, and how is it different to other things that you offer? So how does it differ to Profhilo, and why would they maybe look at getting both? So, you know, do they want that instant hydration? Do they want that instant change? And then maybe you could look at the polynucleotides alongside that to boost what you're doing. And then consider your introductory pricing as well, and look at people around you, get advice from other practitioners, don't be afraid to ask.
Can I just say, one of the things that I said in our last conference before we move on to Profhilo is make sure that your marketing is aimed at who is important. And I say this, a lot of people feel they've got something to prove, and they aim their marketing at their fellow colleagues. So they try and put it, everything they're thinking about is trying to use the language that their practitioners may understand. we really understand, because one of the questions was, what is the simple way to explain it? You need to first understand it. So get involved with it, truly understand the product, truly understand what it's about. And when you feel very comfortable with it and you're able to kind of then synthesize that and make it simpler, do that. You know, Megan put a really good little tip up the other week ago on our Nurse Network page, which was looking at the questions that get asked on Google about something. So if you search polynucleotides, it might give you a suggestion of some questions that people ask about polynucleotides. Look at that, because people don't necessarily know. But what I would say is really understand what polynucleotides are, truly understand it, and make sure your language is right. And then truly, when you do understand it, get excited about it. The most important thing is energy. When I knew I wanted to train in polynucleotides, nobody was offering training, and I hunted down the person offering training. And I have literally been so excited about polynucleotides from the minute I got invested in it. And you have to pass that energy on to your patients for them to get involved in it. But the key is, when you get all that and you build up that hype, like Megan was saying, you do that launch, you bring it into clinic, and then sometimes people make the biggest schoolboy error and they just move on to the next thing. No, stick with it, keep that energy going. There is no limit to what polynucleotides can do, and you can introduce and interact and build this into your protocols. Yes, you can. Somebody asked earlier on, can you run it alongside Profhilo? Yes, because they do completely different things. Can you run it against other things? I can tell you categorically, and this is not about me, so I don't want to chirp on, but if someone's having teardrop failure and I've assessed them and they're medically suitable for it, I will prime them first with polynucleotides. Whether they want to or not, I am doing it, because that is the way they're going to get the best result. If I'm doing a full face transformation, when they come first, I might prime the tissue first so they get a better result. When they're having a neogen, or in, for example, me and excuse me, Grace have a neogen, Megan has an RF microneedling machine. We all prime our patients with polynucleotides before they have that. So understand that polynucleotides are a standalone treatment, but they are integral to the success of nigh on everything else you're doing in clinic. I can work massively in congruence with them and synergistically with them. So, you know, if you really do need to get in bed with them if you're not. But here we are with Profhilo.
Just to add to the marketing, sorry, Kate. If right. I know I'll probably speak for you girls as well, but I'm more than happy if people are thinking of bringing polynucleotides to share my before and afters. As long as you give credit to my clinic, I'm more than happy to use my photos to show your patient on your social media. Just please credit any of us girls. But if you want some images and you can't find any, please contact us. We have tons.
Yeah, we've got loads. All Definitely. Of us.
And I think as well, that is something that getting those case studies in when you first start offering it is so key, because then when you start getting the results back, you know, they're not going to be instant. So you need to be thinking ahead. And then when you do get those results, because you will get those incredible results, posting them to your social medias, you know, on a green screen with you talking about these incredible results will bring the bookings in, because the results are insane. Like, they are insane. So yeah, sorry, moving on to Profhilo.
Do you know what, that sounds really bad? Can I just say, like,
we love Profhilo.
Like, we are like massively engaged and inspired by polynucleotides. You need to get that. So please know, we are not hating on Profhilo. I'm just going to get in there from the beginning. Massive disclaimer. All three of us offer Profhilo in our practices. Yeah. All of us do. So we have to make that clear. Everything has a place. Somebody has asked, would you give patients who have Profhilo polynucleotides? No, give them both. Understand they both have a very, 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 very different mechanism of action, and they can work beautifully together. So really understand that. But yeah, so I'll shut up now. Go on.
On to Profhilo.
So what is it? Hopefully I'm not teaching you how to suck eggs, and I think we've kind of gone through a little bit of this already. So it's a mixture of high and low molecular weight hyaluronic acid, like Kate said. It is not a linear product either. So low molecular weight HA can create an inflammatory response within the body. So a small amount will be required. So a lot more high molecular weight HA is utilised within this product, so that you can get the benefits from both. So it is a biostimulating gel which boosts collagen, elastin levels, hyaluronic acid levels within the skin, and gives you a beautiful glow. I absolutely love Profhilo. So that's just a whistle stop about Profhilo because I don't want to bore you too much. So just moving on to hyaluronic. Oh, sorry.
Somebody tell me, I just only the question. A lot of people say, do people understand the reason why they have high and low molecular weight in their HA? Is that would you like an explanation of why? Because a lot of people know they have it, but they don't quite know why. I don't use Philo.
I can't see the box.
Okay, all right, okay. I'm not going to explain because I will be here forever because I never shut up. The girls will tell you, but I'm just going to say really, really quickly. High and low molecular weight is, think of it, it's the same as medicine when we talk about the molecular weight of medicine. And depending on the size of those molecules will depend where it goes. It's the same with medicine when we talk about passive diffusion or how it gets from A to B. So with Profhilo, it's just about the depth that it will go to. So previously I mentioned that some of the polynucleotides are 1500 Dalton. That's rote KDA when you talk about medical language. That just basically means it's too bloody big and it won't go deep enough. So it's not going to work with microneedling. We have to implant it with a needle. So when we talk about high and low molecular weight, it's just about where that's going to go, and that's it. But you have to understand the body turns over a third of hyaluronic acid a day. If you're menopausal, if it's a hell of a lot less, it's a hell of a lot more. So it is just HA. I'm not hating on it, but it is HA. Just saying.
So Kate has already touched on this. So naturally occurring, found in skin, joints and connective tissue. So we turn over a third of this in our bodies a day, and we lose 10% per decade, sadly. So older skin produces less HA, but is still losing that hyaluronic acid. So in turn, definitely needs some replacing. So it retains moisture in the body and helps with collagen production as well. So it can hold up to 1,000 times its weight in water and binds moisture in the skin, which is why we need to be super, super careful when injecting it into certain areas of the face and be aware of those danger zones in terms of lymphatics and drainage.
It's essentially a water-loving sugar, if that's an easier way to explain it to patients. It's water-loving sugar found within the tissue.
And it will make you glow. So what does it do? So hyaluronic acid drawn into the tissues helps you hydrate those tissues to get that instant glow that people love before an event, but there's longevity issues, so that glow does not last. I always, personal experience, feel like a queen on day 2, but then by week 3 I feel very horrible. So there's no change at cellular level, unlike polynucleotides, and no benefit on cellular proliferation.
In my clinic, I would say if somebody has an event, they have something that they want quicker, more noticeable results instantly. For example, my birthday, I will have 2 courses of Profhilo. If you want more longer term results and longer term changes, then I would recommend polynucleotides, depending on what the reason the person is having either treatment. It depends on what you would recommend.
Yeah, definitely. I agree. Like before my wedding, Profhilo all the way.
Somebody just mentioned then quickly about HA. So HA, about Profhilo. What we've got to remember about Profhilo is it's essentially the patent with Profhilo is to do with the hybrid complex bonding essentially between their high molecular weight and the low molecular weight of HA, and there isn't a use of those chemical compounds to combine them. So it is essential. We're not saying, by the way, that Profhilo is bad. Profhilo is fantastic, but if anyone has been using Profhilo as long as I have, I think what I would say is I think I trained in Profhilo in 2013 13. So that's a long time that I've been using it. And what I will say about Profhilo is some patients will get an unbelievable response, like photo shop response. Like I can show you some insane results from Profhilo, and other patients will get a very different response. And I think that is to do with the fact that, remember, to build collagen, to make to make big changes, remember, we can't build collagen unless we have the raw materials to build collagen. So if we're putting something in that's going to pull hyaluronic acid, which is going to create a little bit of an awakening, if that particular patient doesn't have the key amino acids, the key A, B, C, the glycine, the proline, all the things that are needed to create that collagen, then we're not going to synthesize that collagen. And it's about having those raw materials. So so you'll get great results in some. If anyone who's been on this has been using Profhilo for a long time, you will definitely be able to relate to the fact that some patients will get an insane result that will last longer than others, and other people won't. I tend to use Profhilo, and I have used it on my neck, and I get good results. I would say for about 6 weeks, it's an okay result, but then I find that it doesn't go. Me particularly, I tend to use Redensity 1-bioteoxane because that gives me hyaluronic acid with some amino acids as well, some vitamin minerals. So I feel like I'm getting a little bit more than just HA. So I think it's about understanding what's in the products deeply, and not just what, you know, the big terminologies of hybrids or complex, you know, complex interactions, to truly as do our own due diligence and understand what's in them and understand how that achieves that. Because sometimes they'll say this will achieve that when it can, but it's not a guarantee depending on what other those raw materials are there. So please understand, there is not, we're not here saying that it is not you know, it's not a suitable product or it's not a good product, because it absolutely is. What we're saying is it's a very, very different product to something that is classed as a regenerative medicine.
Yeah. And I think it's all about like priming the skin, getting it ready, and like Kate said, getting the building blocks there before you're utilizing other products, priming the skin, and then definitely using Profhilo or whatever it is that you have in your toolkit available to you to give that patient the best result possible.
One of the questions that somebody asked was about cellular changes. So what we're referring to is, because we're comparing polynucleotides with Profhilo, both products we love and you use, polynucleotides work on receptors. So if we think about how, say, botulinum toxin works, it works on receptors, you know, so it binds to receptors, and then it does what it needs to do through that process. That's exactly what polynucleotides do. They work on the A2 receptors. They stimulate a wound response. We are just saying that and essentially it's fully absorbed. Hyaluronic acid or Profhilo, for example, it's not necessarily working on receptors. We're just trying to draw the difference between a
I've lost you, Kate.
Yes, she's gone silent.
I'll let her back in a minute.
Oh, she gone. So we're just moving on to the safety profile while Kate's disappeared, because obviously we did it with polynucleotides, so we just want to have a little look at Profhilo as well. So we talked about VOs or vascular occlusions. There is a low risk but not no risk with this product. So lymphatic drainage we've touched on as well. It is a hyaluronic acid product, so it will pull water into the area that it is injected into and the area around that. So you may well end up with some lymphatic issues, so you just need to be aware of that. Allergy, normal allergies, and to kind of go through in your pre-injectable advice and precautions. So that's what I would go through in terms of safety. I don't know if Grace, you want to add anything on?
Just to obviously Profhilo isn't made to go in the periorbital region. So
No.
just one of the key differences between Profhilo and polynucleotides is obviously polynucleotides does have a product made for the tear trough area, where Profhilo is obviously made to you avoid that area.
Yeah, so just go off of what you've been taught, so your back technique, and just make sure that you are staying within that profile of injection technique. So we have created, we have a membership platform, and as part of that we have free resources. You can go online and sign up using your email address, and one of them is the polynucleotide cheat sheet, which just gives you the summary of what polynucleotides are, what they do, how to utilize them, and where they come from, and then again going through the safety profile. So it just gives you a quick run through of everything that we've gone through in this webinar.
Just to touch on a couple of the questions. So you can use polynucleotides in the forehead region. Obviously, I would be mindful again of product choice and dosage. So you could use, I speak in Chroma's language, so the filler or the 20 milligram a mil product. Technically, you could use the hybrid, but obviously because of the mannitol in the hybrid, your bumps, the little blebs that you leave, can last for up to 5 days-ish, where you will find that the product with it is just the polynucleotides, the 20 milligram a mil. The bumps tend to absorb a lot quicker. So if I was going to treat forehead, I tend to reach for just the pure polynucleotide product.
Yeah. So.
And in terms of what size cannula for eye area, I would just carry on using your 25 gauge cannula.
Agreed.
Oh, she's back.
Oh, she's back. This voice that joins us. Love it. Can you see my screen, Kate?
Yeah, I've been here the whole time. Don't worry about me.
Oh.
I've been listening.
Perfect. So oh, you go, Grace.
I saw a lot of people asking questions, and I was trying to bite my tongue because I knew this slide was coming. But our nurses network, so you can sign up. We have 3 different platforms. So we have a completely free platform that you can sign up, which you get access to some of the cheat sheets that you've just seen. You can see the emails, see the webinars that we're doing, and then we have 2 other platforms, so which give you different levels of support, I guess.
Yeah.
Someone want to jump in? No, I don't want to.
Yeah, so we have Nurse Network goodies available online. So we've got hoodies and all sorts of lovely things that we have as part of our goodies, including a ring light. If anyone's on the reels, then you definitely need to get on the ring light, just saying. So access to free webinars, and they tend to be focused on what our members want, but also what we would have wanted when we first started, or what we would currently want to learn about. And we also have lots of partnerships where they advertise and come on and talk about their free webinars as well. So we had one recently with a lovely lady who helps with CQC registration. So she went through and discussed webinars for our members about the process of CQC registration and how to go through that. So that's something that we offer, and we offer really regularly. We also do some practical training events, so you get a massive discount on our practical training events, so that's 35% off. We offer one-to-one mentoring with each one of us at our clinics, and that's 25% off of that, which is a massive saving. And then 25% off business mentoring, discounts with preferred suppliers, which was
that's a great one.
Yeah, definitely. We've got some incredible suppliers as part of our online membership platform, and we have
Acre Pharmacy being one of our supporters and preferred suppliers that you can get discount off, hence us being on your screens tonight. They are great with us.
Definitely. But we've got, yes,
with great discounts on, and it's not just, it's a really wide variety of products as well. So it's it covers quite a wide range, and even consumables and things like that. So you get great discounts that you can access.
Definitely. And then a big discount on our Nurse Network events, which we will touch on as well, and free access to our Christmas party, because we know once you join Aesthetics that you don't get one of those anymore, which is very sad. So hopefully you can be a part of our Christmas party, which is a very, very fun to attend, and our regional events as well in different areas. So your local area, once you join our membership, we place you into a regional chat and we have events in the different regions.
Which we support. We have coffee mornings, training events. You've got your dedicated WhatsApp, as Megan said, with your regional and one of us as the team. So we are creating our kind of close-knit, more supportive groups, and then you have us as a whole. And just to put it out there, the Christmas party sold out in 2 days last year, and it was a great Christmas party.
It really was. It really was.
So for coming to this webinar, you get 10% off of your first month's membership with us with the code TNN Acre. So when you go to sign up, you just pop that code in. So if you want to take a little photo of this, then hello.
And it is not just for nurses, it's for any medical professional. It's only called TNN because we started doing podcasts and we were the nurses that network. So we called it the Nurses that Network. In hindsight, we should have called it the Medical Professionals that Network, because it is open for everybody. So you are all. You what?
It wasn't as catchy. The Nurses Network, but it totally. You're completely right. I think we definitely need to continue to tell people that that everyone.
Line underneath our logo, not just for nurses.
Not that. Yes. Yeah, we need to.
We do have
not Yorkies, not just the boys.
So one more thing, just to say thank you so much for coming along to the webinar. So we have an incredible conference coming up in May. That is on the 25th of May this year at the Belfry in Birmingham. Our other events have been absolutely incredible, and like Grace said, they sell out pretty quickly. So we've got an early bird offer which ends on the 25th of February. We've got some incredible speakers, and just focusing on, you know, what we've spoken about: polynucleotides, regenerative medicine. So we're talking about everything in regenerative medicine, and it's definitely not to be missed. So we are offering 10% off of the ticket price with the code TNN newbie tickets. So yeah, and there's the link.
But we also, just to get in there as well, we have 4 days left anyway of our early bird prices. So the early bird offer that was launched to everybody runs until the 25th. So this 10% is in addition to that early bird. So on the day, we're going to be talking about obviously all the business stuff that everyone loves and come to know from us. But also we're going to be talking about exosomes, polynucleotides. Acre are going to be there. Everything's going to be there. Some incredible speakers. We're going to be there. I mean,
you're missing the most important, and you're missing a huge part, Kate.
What?
There is also an after party after this one too.
Absolutely. The most important thing. You know what?
You missed the Christmas one.
Totally, but this is the most important thing, is that everyone kind of gets the opportunity to really network, get to know each other, because we know a lot of people can find aesthetics quite lonely. So anyway, thank you all, and a big thank you to Acre as well for making this happen. We hope that, you know, you guys found it useful.
And one of the questions we had is anybody based in the south? So regardless of whether Kate is, but regardless of whether you have one of us in your area, so obviously me in Wales and Kate down in Kent, we have regionals placed in every area, so you won't feel unsupported. There is a regional for every area. That I had the unfortunate task of learning all of the areas, and geography is not my strong.
So yeah,
but we have one.
Yeah, you'll definitely be supported. There'll be an exclusive offer from Acre Pharmacy, first purchase, first served, and that will be sent over to everybody who attended this webinar in an email very, very shortly. And just to finish off, is there any more questions for any one of us?
Feel free. We'll do a few more minutes just in case anyone wants to.
Yeah. Oh, to the Welshies. I saw someone from Swansea. They're all coming out the woodworks now. I get so excited when I see people from Wales, because we are so on our own.
Yeah, and thank you for attending, everyone, as well.
Can you use? Did you use BAP techniques for rosacea, Megan?
No, so I just used blebs and focused it on the areas that the rosacea was, basically.
Have you ever used polys in the lips? You could. I mean, Acre have done some great content recently about using Jala Pro Classic in the lips as well.
Yeah.
I mean, anything that treats the skin can treat the lips.
Definitely.
You know, so yeah, I'd just be conscious to just make sure you're using the right techniques to treat the lips and keeping it superficial.
And just think about pain relief.
One thing I've just written down is maybe there are protocols for Mastelli products, is maybe we'll design a little TNN handout that you can have the protocol, whether it be kind of a recovery treatment at 14 days, so it's shorter, or maybe just a prevention treatment at 21 days. We'll pop the protocols on. I'll get this sorted for you guys.
Somebody said, do you need to train for this? The thing is, what I always say is, I would always say, train in everything that's new to you so you truly understand it, because I know a lot of people who've just ordered products without actually going on any formal training, and then they find themselves coming unstuck, whether that's to do with how, when they're consulting with patients, how they use it, how they explain it. So yes, I would go on training. You can access training from multiple places. We're not just saying train. And yes, we do offer training as the Nurse Network, but Acre offer training and many people offer training. We don't ever really comment on individual brands. All brands are great. Today we're just kind of commenting on Polynucleotides with Profhilo. Both are brilliant, both we love and we'll continue to use. Do you always treat the exact area of do you check there? Let's have a look. Nucleophile scarring. Yes, it's great for scarring. It's great. There's been a lot of people who've actually used polynucleotides at the same time as a wound. So I've seen it being used with great success on people who've had injuries. Literally immediately, like days after they've been stitched up. We've used it post-surgically. We've used it as a pre-surgical skin priming. And we've also used it with great success in skin grafts, and I've also used it in a necrosis recovery treatment. So the opportunities are endless.
And in terms of the protocols, I've seen that someone's asked. So there's two types of protocols you can do. You can do a more intensive protocol at 14 days apart, or a less intensive protocol at 21 days apart. And then you have obviously your fourth treatment, and then your maintenance can be anything from 1 to 6 months afterwards, depending on the patient in front of you.
Mm-hmm.
Let's have a look if there's anything else.
Any more questions?
I
can't see them. Just sat here.
Okay, so one thing so just to kind of go back, there's a lot of comments on here about puffiness, so I'm going to try and respond to them so it ticks a lot of people in one go. Puffiness under the eyes is very generic. It's a very generic explanation for what can be a very complex issue. If someone has festoons, if someone has maloedema, they're very different things. If someone has blocked lymphatics due to compression, blocked lymphatics due to recovering from sinusitis, or they have had toxin for a long period of time and they have a very sedentary lifestyle and their lymphatics are sluggish and therefore they've got puffiness. These are all very, very different things. What I will say is, if someone has significant swelling under the eye, it is puffy, it is swollen, it's extending down the ligament, you're seeing maloedema, nothing good can come from playing with a lymphatic. If the lymphatic isn't happy, leave it alone. If someone just has has got laxity on the under eye and has very rare intermittent swelling, that's a different kettle of fish. What I will say is, if I'm treating a patient who has laxity, they are an amazing patient to treat. If someone has poor skin quality and we want to prime it for potentially either an electrical device or a dermal filler treatment, then I will probably just adjust my protocol to treat them with a 7.5 milligram, and I probably will treat laterally as well, going across the zygoma, potentially going into the temporalis, because to treat an area, we don't have to directly treat an area. As you can see with polynucleotides, treating the face improves the neck. So if we want to improve the under eye, we can treat the portions and the connecting tissues around it, and it will have an impact. So it's very difficult for us to say, can you treat a generic yes or no, someone with puffiness under the eye, because that is very patient dependent and it really depends on the level and what we're dealing with. So what I would say is more to come from this, but if you do come to the conference, we are going to be talking about polynucleotides. We do have Dr. George Christopoulos there for a full hour nearly talking about polynucleotides, and he is the god of polynucleotides. So keep all these questions written down and hit him with it at the end. And yes, there is a free membership. There's 3 different tiers. 25th of May.
And I think what Kate said as well is important. When we say puffiness under the eye, you can have fat or edema. If you don't know which one, it could likely help slightly if it's fat and you're improving the skin quality. If it is a full-blown edematous under eye, like Kate said, it's not going to help.
Okay. Yeah, it's the 25th of May. It's in Birmingham. Because our members are all over the UK, we've had to keep it quite central. We do have early bird tickets available. You will be attending. The whole day is catered for. Lunch is included, goodie bags, full day of training. It's CPD accredited. And also you do have an evening party that is available for the first 50 people. And I believe last time I looked, there are 12 tickets left to the evening party. So be quick. You do not want to miss the best part of the day.
Definitely not.
Right. How does it compare to PRP? PRP is great. It is patient dependent. It has incredible results. We've seen it used in medicine successfully in multiple areas. PRF is making a lot of noise at the minute. Again, has a place. But if you have a clinic that is not CQC registered, therefore you won't be able to do PRP. So potentially this is a different way of accessing regenerative medicine. Or if you do have PRP, if you are CQC licensed and you do want to offer PRP, then it could be something that you intertwine. I have great success when I'm treating patients for hair loss. I'll potentially treat them with polynucleotides hair, and then I'll treat them with PRP, and I'll bounce off, get the best of both worlds. How would you combine with the treatments?
In terms of leaving and combining with other treatments, so obviously you can do for things like toxins or it would actually depend on what other treatments you were doing and which way around you were doing it. So if you were priming first, you could probably leave a slightly shorter time. But if you were looking at doing things like fillers and toxin first, obviously you would want to leave a large time. So unfortunately, we can't answer that with a one size fit all because it does depend on what you're treating.
And yes, you could use polynucleotides at the same time as skin boosters, but skin boosters predominantly are going to be HA. Remember, there are polynucleotides that have HA. So if that was going to be your protocol, maybe looking at using one of those hybrid products would be more cost effective for your patients. If you didn't want to do them at the same time and you wanted to get the benefit of the higher polynucleotide milligram, I would probably treat them with the polynucleotides and bring them back and rotate it with a skin booster. Me personally, because of my relationship with Teoxane, I tend to use Redensity 1, so I tend to intertwine it. I don't use the hybrid products. I'd rather get the higher milligram of polynucleotides and just focus on a polynucleotide treatment and then move on to skin booster. But we all have our own rationale and we all do things in our own ways. PRP is another certain mode of action. Apparently I was told none are stabilized. I want to know if it can be used on someone with rosacea active.
So with anything that you aren't sure on a treatment, patients on an active treatment plan, then please do remember we are medical professionals and we do work as part of an MDT. So if you're not sure, you can always reach out to that patient's specialist nurse or as part of the MDT and ask whether they would be happy for you to be adding in another DNA-derived drug alongside their treatment.
Right. I think we're ready, girls, to wrap up. Have we pretty much, I'm thinking we've kind of just the conference have training. It's not hands-on training, but you will have extensive training about polynucleotides. You'll have an exosomes training. We've got Dr. Ted Patel doing a regenerative medicine talk. We have a live demonstration of a target cool and how that can administer exosomes. It is CPD accredited, so you will get CPD accreditation hours for it for those of you. Can it be done with back too? Back techniques tend to be done because Profhilo is very viscous and because of the depth. Polynucleotides are much more superficial and we want to make sure we get great coverage. So I wouldn't advise you just doing the 5 techniques. I would advise you to get a much wider coverage on the face.
Mm-hmm.
And if we have missed anyone because we are at time, then please feel free to email us. Our contact details are on the Nurse Network's website and we will get back to your question.
Amazing. Thank you all for coming, and thank you,
Yeah.
Acre, for everything.
Hope you enjoyed.
Thank you. You've been
Thanks,
great. Thanks for
ladies.
everyone for the question.
Amazing.
How do I?
I think that's us.